Hey guys, sorry I am a few minutes late. I was taking the time to try to adjust the lighting so I didn't have a glare on my glasses. And I just finally settled on putting my glasses on my head. If anybody has any tips or tricks on reducing the glare in glasses on a video, I certainly appreciate them. So today is Q&A Wednesday. Today will be amazing, and it already is amazing. My little ones I have two big children. I have a 5 and a 7-year-old at school, and my little guy's at childcare today. I had a counseling appointment today at 11 in Kenwood, and that was amazing. And I have to be really real with you guys and say that I am just kind of like tired and crampy, and this day is gray. But I am committed to doing these Q&A Wednesdays, and so here I am. I posted this morning and asked for people to ask questions, and I got a really great question. So we're going to talk about doing the next best thing, and what are your choices or options if a cesarean birth becomes the next best thing for you. So we'll be talking about that. I am going to just pause for a second here in interacting and share this over on my personal page. So I will be right back to you. Feel free to ask any questions that you might have. I really enjoy the opportunity of just sitting down and chatting with my friends and family and clients. And actually, the woman that sent me a question was someone who I met with, her and her husband, for doula services, and she found a doula that was the right fit for her, and it wasn't me, and that's okay. So everybody has their own doula, and like who's supposed to be their doula, and I am not supposed to be everybody's doula. That is for sure. As a matter of fact, I am not able to be everybody's doula, and I have limited availability. So I can only take at this time 2 clients each month, and I am currently full all the way through March of 2018. Hello, it doesn't show me who's here, but I see that somebody's here. I'm just taking a minute to share this live video over on my profile, on my personal page. And so I'll be right back to you. Voila, there we are. So again, it is a kind of dreary Wednesday, and I'm crampy and my back hurts, and you know, it's just moving through those cycles of life. So swipe left to see, swipe to reveal comments and reaction. Okay, here we are. So let's talk about doing the next best thing. Last week we talked about choosing a supportive care provider and why that trumps writing an extensive birth plan, but also the value in looking into your options, and writing a birth plan is so valuable and important as well. Now let's jump to the next best thing and what that means. So I talk about the next best thing in all of my childbirth classes and prenatal visits and in the moment at births, that we as women, as people, we do the next best thing in each moment. And the next best thing could be getting in the shower. The next best thing could be trying out the birth ball. The next best thing could be getting an epidural. The next best thing might be having a birth by cesarean. And you'll notice that I do say birth by cesarean over saying a surgical birth or a C-section or section. I try to stay with the terminology of cesarean birth, because no matter what way a woman births her baby, it is still her birth, and it is still the birth of that baby. So if we as a culture can try to shift to this terminology, I know that there are varying schools of thought on this, and I understand that and can see all sides. But for me personally, in my practice, I have seen that when we go into birth with these really restrictive birth plans and only looking at it, that we succeeded if we have a natural vaginal birth. We're setting ourselves up, and we're setting up the clients and people that we work with for birth trauma if we are pointing them in the direction that there's only one way to give birth, or the physiological normal way is this way, and anything but that is not normal. But I really believe that all people do the next best thing along the way. And we all have the best interest of mom and baby in mind. And so when things come up for us in our birth that require us to start thinking about or acting on a cesarean, oftentimes it's an emergent situation where we're just moving in that direction. And I think it can be better to be proactive in your earlier stages of birth planning and childbirth preparation, to just start thinking about what are my options if a cesarean birth becomes the next best thing for me and my family. So does anybody have any input on that? I'd love to hear it, what your thoughts are. So doing the next best thing is what we all do to birth our babies. There's different options in the way of having epidural or general anesthesia. Most of the time with cesarean births, there is time to prepare mom for the procedure or the birth by getting an epidural before they go back, but sometimes it's emergent and general anesthesia is what becomes the next best thing. But I would say that if you have a choice in the matter, and as care providers, I think it's always their top choice for the mom to have an epidural over general anesthesia. Another thing that you can request is to not be given the medications that make you extra calm. So there is a lot of pulling and tugging in the case of a cesarean, and I think that they are, your anesthesiologist, the care providers are all thinking about how much they don't want you to be uncomfortable. But you might ask if there are drugs that they can give you that won't make you as drowsy and maybe will help you to be more alert throughout the process. Another tip is to ask for a clear drape if that's something that would be of interest to you, of actually seeing the birth through a clear drape. So the alternative is it's normally a blue drape that is not see-through, and it's about from your chest up, and does create a barrier so that you can't see the birth, but they often hold the baby up on the other side. But you can request, and a lot of the hospitals have gotten these clear drapes. Of course, there are people that are completely opposed to this, women who say there's no way I would want to watch, and that's okay too. And there are women that have reported it is beneficial for them to see the birth and to be connected with the process of what's going on as opposed to being disconnected. So it's really personal preference, but it is an option. So just knowing that it's an option for you to have a clear drape. So we talked about having an epidural over general anesthesia is always, I think, everybody's ideal situation. No extra relaxing drugs, possibly having a clear drape. Having the EKG monitors in a spot maybe on your back as opposed to on your chest, so that when baby comes out and is possibly able to do skin to skin with you, they can be right on your chest as opposed to being like with those EKG monitors on your chest. So if those can go on your back, it's something you can ask about. So then jumping to skin, is that an option? At many hospitals in the area, it is an option for families to do skin to skin immediately following a cesarean birth. So baby comes out, they might check on the baby at the warmer quickly and then get baby right back to mom and tuck baby under her gown. And I don't know that I've seen them bring baby directly from the womb to her chest, but I would definitely ask about that. With all of these suggestions on things to ask about, you might be looked at like, oh, like, are you sure you want that? We know what we're doing. But I think that the more that we ask about having a more family-centered birth, the more hospitals will act on those requests. So it never hurts to ask, and I've even had families that don't just ask, but rather demand that they have some of these things. So we talked about a couple things, but then moving on to, can I breastfeed in the OR? And I've heard a lot of hospitals say, well, you can breastfeed immediately in recovery. Well, is it an option for me to breastfeed in the OR? So if we're in there for 45 minutes, can husband, partner, someone help get baby to the breast in the OR? Is that an option? And what does it take for us to get there? Maybe it is extra people in the OR, extra hands on board. Delay cord clamping. So I can post a link to the benefits of delayed cord clamping in the comments, and I can actually post a video as well to a family-centered cesarean. Let me just make a little note here so I don't forget. So you can make the request to have delayed cord clamping, and even if it's just an extra minute on what they normally do, or an extra 2 minutes or 3 minutes, the longer the better. What we're waiting for is all of the cord blood, all of the blood to go from the placenta to the baby. And so the longer the better, but even if it's just they compromise with like, okay, we'll get an extra minute longer than we normally do. That's still better than nothing. Having your own music in the OR is something that families have enjoyed. The OR in general is pretty quiet, or maybe they have on, like, I've listened to, I want to say like 94.9, or just a really typical radio station with commercials and maybe music that you're not used to or comfortable with. And so just requesting your own music or requesting to wear headphones can be an option. Asking for people to talk with you. So I don't know how true this is, but I've heard that the doctors are trained to talk to one another about more typical run-of-the-mill day-to-day activities so that they're not as connected with the patient as a person. Again, I don't know how true this is. This is just something that I've heard and it made sense to me. But you can absolutely request for someone to give you a play-by-play of what's going on, whether it's the anesthesiologist or your husband or partner or a nurse, to just really talk you through what's happening to your body and how is your baby doing. And again, you may not want this, and that's okay too. So you may and you may not with all of these suggestions. They're merely suggestions. Take them as you will, and always talk with your care provider. Another thing is a vaginal swab. So that's becoming more, there's more evidence supporting, and I'm going to put a link to this in the comments as well, because I really don't know a ton about it, but I know that there's benefits to the vaginal microbiome that is in the vaginal canal, and babies that are born via cesarean miss out on that. And so there have been people that do a swab inside the vagina and then later do that same swab into the baby's mouth. So talking to your care provider about, is that an option? And even if it seems out there, maybe you bring them the evidence that you've found and talk about, if it's not normal for them, is it okay for you to have that done or request it? And then delaying the newborn procedures. So we talked a little bit about baby coming right up to your chest or going over to the warmer to be evaluated and then brought to your chest. But you can ask for the newborn procedures to be delayed. So things like weighing the baby or doing the standard newborn procedures like erythromycin, vitamin K, hepatitis B, can those all be delayed until you're in recovery? Can you get that prime time of an hour skin to skin in the OR before the newborn procedures, and especially before they're bathed? Normally, I have seen that most hospitals are moving towards 12 hours at least before the baby gets its first bath. But one of my doula friends said that she was just at a hospital and they bathed the baby. I mean, it was like right away. She got there right after the baby was born. And of course, this is all like second I wasn't there. But she said that the baby was already bathed. So anyway, all this to say, you can ask for newborn procedures to be delayed. The weighing, the height and head circumference, and the erythromycin, vitamin K, and hepatitis B to all be delayed for up to 2 hours. Again, talking with your care provider. And then can you have extra people in the OR with you? So I've been back in the OR with several families now, and it really took the families not just asking for extra people, but being proactive in talking to their obstetrician, talking to the anesthesiologist, and then bringing it up on the day of their birth and kind of as a non-negotiable. They wanted their doula in the room. This was most helpful with a family that I was with who had twins, and the partner was on one side and then I was on the other side. And when the babies came out, they both went to the tables, over to the warmers, and I stayed with mom. So having an extra person there can be so helpful. I really saw it in action there, how even with just one baby, dad or partner really wants to go be with the baby and check out the baby, but at the same time, if he does that, he's leaving his partner there on the operating table without him. So having extra people, I know that the OR is incredibly small, but really with a chair or a stool pulled up next to mom's head, it can be so comforting and make it much more of a human experience than a medical procedure, which is really what all of these different requests are all about: having the epidural and staying awake, not having drugs that are making you super drowsy, requesting a clear drape to be more connected to the process, doing skin to skin after your baby is born, breastfeeding immediately or as soon as possible, delaying the cord clamping, having your music playing, asking for people to talk to you throughout the process, the vaginal swab, delaying the newborn procedures, and extra people in the room. These are all just to try to make it a more human experience and less of a medical procedure. You will notice if a cesarean birth becomes the next best thing for you, that it is referred to a lot as a procedure or a section, or there's just a lot of what sounds to me like derogatory terms, but I think that people that are just doing it on a day-to-day basis, they forget that this is the birth of her baby, and the more that we can use terminology that reflects that, this is the birth of their baby as a family, this is the birth of this baby, this person into our world, the more that we can reflect that in the words that we use, the more satisfied a mom is going to be with her birth experience, in my opinion and in my experience. So we talked about today doing the next best thing. We talked about options that you might have in the case of a cesarean birth. I'm going to post links on that vaginal microbiome, a family-centered cesarean video, and if there's anything else, I'm here and I'm open to answering questions, and that's all. It was so great to hang out with you. I see that I have viewers, but I don't know who you are. So it was nice to hang out with you today, and if you are looking for a doula, I am available in April 2018 and beyond. And then the main thing that I'm focusing on right now is the Cincinnati Birth and Parenting Network. And through that network, even though I'm not available, I'm able to refer people to the network. Or even though I don't offer massage therapy or counseling or pelvic floor therapy, I have this wonderful network of professionals that I can refer to. And we have a monthly meet and greet. Our next meet and greet is coming up on September 27th at Muse Cafe in Westwood, and it is from 7 to 9 p.m. and all people are welcome, and yeah, it's going to be a good time. I ordered a couple cheese trays, a bruschetta tray, and sparkling water and hot tea, and we can mix and mingle, and you can ask questions related to whatever service providers are having an expertise in. It's sure to be a good time. And for children, I'm going to have just like a table that's set up with some crayons and coloring pages. So in the day of age and time of technology, I don't know how interesting coloring pages are, but we'll try. So I think that's all for today. Happy Wednesday. I look forward to seeing you next Wednesday. Another thing, sorry to keep rambling, but I'm doing a personal social media detox again in October. I have several moms who have estimated due dates in October, so I will still be active here on my business page, Molly Murray, Birth, Life, and Business Doula, and I will still be active on the Cincinnati Birth and Parenting Network, and I will still be active on Natural Life Cincinnati, which is my partner's health food store. So I'll be running and managing those social media platforms, but I will be stepping away from my personal page, so don't take it personal if I'm not interacting with you on my personal page, and do direct messages here. I'm getting my hair done tomorrow, and we're going to go live at her shop, so look forward to that. Her page is Samantha Voigt at Salon Lofts. And yeah, all right, have a great day. Talk to you soon.